Caitlin Dale and this is video 18, performing a blood smear. So first, before I begin, I do need to collect all of the necessary equipment. So here I have my dry, clean microscope slides. I have my blood, fresh or mixed with EDTA. I have my fixative and my Diff-Quik solutions. I have my 1 ml syringe here to collect my blood from the tube and put it onto the slide. I also have the microscope slide cover if needing to send away to the external laboratory. I have the hairdryer if needed, and I also have the microscope just behind me here. I've already got my PPE on, so first I'm going to grab my clean, dry microscope slides. I'm going to get a few just so I can make a few copies for the vet to choose from. I have already placed on there the patient ID number and the patient name. So ideally this does need to be in pencil so that the any ink that you may use, like a Sharpie pen, doesn't run into that blood sample. But unfortunately pencils are a little bit hard to come by in my clinic. I'm also going to get another microscope slide to use as my spreader slide. So I'm going to collect some blood from the EDTA tube, and use my 1 ml syringe to collect the blood. I'm going to place a small drop of blood onto the end of the microscope slide with the label. I'm then going to take my spreader slide, firmly hold the sample slide with my finger, place my spreader slide at a 45-degree angle and allow the blood to move along on the spreader slide, and then with a smooth action push away with the spreader slide. As said before, I'm going to create a few for my vet to choose from just in case you're unsure of the quality of your blood smear. We can then leave these to air dry, or we can use the hairdryer on a low setting to speed up that drying process before staining. So I'm going to allow those to dry and then come back and evaluate and then move ahead and show you how I stain. Thank you. Hi, my name is Caitlin Dale and I'm resuming video 18, performing a blood smear. So now that my smear is dry, I can evaluate it. So it looks quite well made. It looks to be a good width. It's clean. It looks to have had even pressure applied, potentially maybe there just in the middle. You can see potentially that the spreader slide may have had a chip or had something on the end of it because there's a few lines through the middle. But in general, it's pretty good, and the edge is nice and feathered as well. So I can use my my fixative and my stains now to stain the smear up for the vet. So first I'm going to dip my blood smear into the fixative solution 5 times for 1 second each dip. Just need to allow the excess fixative to drip off. In my clinic, we do use a paper towel just to dab the end and help that excess fixative come off a little bit quicker. I can now use my pink stain, and again the same, dip it in 5 times for 1 second each dip. And again, allow that excess stain to drip off, using that paper towel again if needed. And then I'm going to do my final dip, which is the purple stain. Again, 5 times, 1 second each dip, and allowing that excess stain to drain off. Once I've done in that order, fixative pink and purple, I can use some distilled water and a clean pipette to rinse off the stain over the sink. and then, as discussed before, either allow to air dry or use the hairdryer on a low setting to speed up that drying if needed. So I'm just going to allow my stain to dry, and then we'll pop back and get it loaded up onto the microscope for the vet. Thank you. Hi, my name is Caitlin Dale and I'm resuming video 18, performing a blood smear. So now that my stain slide is all dry, I can now set it up on the microscope for the vet to view at the lowest and highest powers. So first I do need to take off my dust cover, ensure my microscope is plugged in and on, which it is. I can then lower my stage. I can make sure that my rheostat is turned down to low and that my substage is just below my stage. I can now turn on my microscope and turn that rheostat back up so that I have got a medium amount of light showing. I can now pop my slide onto my stage and make sure it is held in place by the clips. I can now rotate my lowest objective lens, so the number 4, into place and raise that stage back up until it's almost touching the slide but never touching the slide. Unfortunately, this is as far as the stage does go up because the microscope is a little bit old. But once it is up, I can use the eyepieces and just adjust them so that the field of vision does become 1. I can then use the coarse focus knob just here to get the image into view, and then I can use the fine focus knob to sharpen that image. I can then follow that procedure for the 10 times lens and the 40 times lens, always ensuring the stage is moved down before moving each objective lens and click it into place to ensure that you're not going to scratch the lenses. But to be able to view the cells on 100 times, I do need to use immersion oil. So I'm going to lower that stage down. I'm going to place a drop of the immersion oil onto the slide. I'm then going to ensure that my iris diaphragm is fully open. I'm then going to rotate my 100 times into place and raise that stage back up until it is touching the immersion oil but not the slide. I can then use the eyepieces to look at the image, and again use that fine focus knob until the image does come into view. I can now let the vet know that this is all ready to be viewed. Once they have looked at the slide, I can then dispose of my slide into the sharps container bin. I can then dispose of my blood and my syringe into the clinical waste bin, and I can then dispose of my gloves, my paper towel and my pipette into the general waste bin. Thank you.